Hi there, and a huge welcome to another episode of the Transcend and Succeed show. And today I have an amazing guest, Dr. Tom Ingegno. Dr. Tom isn't just your typical clinician, he's a dynamic speaker and the best-selling author of the cupping book, Unlocking the Secrets of Ancient Healing. His visionary approach to healthcare is epitomised by Charm City Integrative Health, a clinic hailed as the future of medicine by futurist David Houle. With over a quarter century of clinical experience, Dr. Tom seamlessly blends modern research with traditional practices, all while infusing his signature humour to make complex theories understandable. So today we embark on a journey into holistic health with Dr. Tom, discussing topics such as cupping therapy, some lesser-known East Asian medicine therapies, and the concept of Yang Shen to stay vibrant at any age. So welcome, Dr. Tom.
Hey, Dawn. Thanks so much for having me.
You're so welcome. It's lovely to see you. So can you tell me what led you to pursue this particular path?
You know, I get to tell this story so much, and it's a great thing because I get to honor my grandfather a little bit. My grandfather was a pharmacist, and, you know, when I was a teenager, I would help him out in the pharmacy, stocking shelves, cleaning up, that kind of stuff. And one day he was counting out pills, and, you know, he's sliding them on the tray, and he looks down, and he goes, these pills are $5 a piece. This patient has to take 3 of them a day, every day of his life. And it turns out that the patient he was writing them for didn't have insurance. He was a day laborer. They give him cash at the end of the day, and hopefully he had enough to feed his family and everything. And, he looked at me and he said, there's got to be a better way of doing this, and I'm looking at you to find it. And that kind of sat in the back of my head. I forgot about that. I was pre-med in college, and there were a series of events that I would call serendipitous. I had no control over. I ended up in an acupuncture school. Halfway through my junior year of my undergrad, I started a graduate program in acupuncture.
Wow. Very interesting story. So let's talk a little bit about, the cupping therapy. So what inspired you to write your book?
Well, we're 4 years out of the start of COVID, let's say.
Yeah.
I had a little extra time on my hands during COVID, and I realized that while I love my brick and mortar clinic, I love treating. There's times when I'm not going to be able to get to somebody, and 2, if we're talking about healthcare as a whole, if we're talking about it for everyone. Right? It has to be as accessible as possible. So a lot of traditional practices are safe. We have some research about them, and they were done in households for thousands of years. So my goal was to try and put this back into people's households. And that's really why I wrote the book. Let's give people some opportunities to take care of themselves. Mm-hmm. And this is a over 4,000-year-old therapy that has been all over the world. So why not start here?
Sure. Well, self-care is very important. Myself and my colleague, we push that quite a lot of the time. So could you explain to us then the benefits of the cupping therapy for those that are unfamiliar with it?
Yeah, yes, definitely. So cupping therapy above all else increases circulation, right? So we know that when we have an injury or an illness, we have some inflammation in the body. We're not getting blood flow happening the way we want it to. When we apply these cups, we create a space. The cups suction the skin away from the fascia away from the muscle, and they increase this space for blood to flow through. This little bit of space flushes out that tissue, right? Fresh blood comes in, gets rid of metabolic waste, any inflammatory processes that are in there, and then allows fresh blood to come in, which has the oxygen and nutrients that we need to heal that tissue. So we kind of set up a 1-2 thing, right? That suction is creating the space and allowing for old blood out, and then 2 new blood in to allow for the healing.
And does that work alongside the lymphatic system then? Does it have any impact on the lymphatic system?
It definitely does. When we talk about it and looking at the research, it seems to be more an effect on the vascular system that we've studied, right? You're not necessarily putting it over areas where you have lymph nodes or lymph pathways, but you are going to, by increasing circulation, you're going to pick up lymph flow.
Okay. All right. What about, considerations, any medical issues? Have you got to take any of those into consideration with the therapy?
So the big things that we talk about in the book, there are no real hard contraindications or reasons you can't do it, but we do want to make sure that we're avoiding pregnant women, and we don't have any research on it. So it could very well be safe, but we don't want to put anybody at risk. The other things that we're looking for is open sores on the body. We don't want to put cups over that, perhaps in an area or near it. Varicose veins that are big, deep vein thrombosis, those things where we have these arteries or blood vessels that are expanded and close to the surface, we don't cup over those. But within that, cupping can be used on kids, it can be used on the elderly, it can be used on people that are sick, it can be used as a form of well care just to keep circulation going. One of the reasons I like it so much is that it has variations through a whole bunch of different cultures. And even the Islamic faith has developed a system that they consider a therapy to be done on certain holy days every month. So we have this unique connection to a bunch of different cultures with this. So it belongs to everybody, and I really like that.
I know sometimes that the cups can actually cause a little bit of bruising on the skin. Is that dangerous at all?
No, this is actually part of the therapy, right? So what we see, and it's funny because we all call it a bruise. It is a perfect.
Okay, we had a little bit of a technical glitch there. So we were talking about the bruising. So please answer, Dr. Tom.
Yeah, sure. So the bruising, right, this perfectly circular hickey, for lack of a better term, is a byproduct of the suction, right? So the suction is actually applying pressure to the skin, and those small capillaries at the surface are the ones that are breaking. And not only does it not hurt, it actually stimulates circulation there for a longer period of time. So even though the initial cupping probably hits and does its thing while the cups are on over the next couple of hours, after that, that bruising requires the body to keep sending blood to that area to clean up those capillaries as well. So you get this prolonged healing effect with that, and they're actually a good thing. A lot of people see them as a badge of honor. I know it's a big marketing thing for me where we have a few gyms in the area. We'll do cupping and somebody will be in the gym and sure enough, they'll say, "Oh, I told somebody at the gym about you," and they'll end up in our clinic a couple days later.
Nice.
Not a bad thing.
I know my massage therapist, I go regularly every couple of weeks, and she uses them a lot.
Yeah.
Just to get things moving, and it does make a difference, I find.
Yeah, and we teach it, for a long time I was teaching fire cupping, which is with the glass jars and using fire to create the vacuum. I do teach that to other healthcare professionals, massage therapists, acupuncturists, physical therapists, because it does seem to, anytime you get to play with fire, it looks a little bit more authentic, a little bit more traditional. But today's suction cups, whether you use a pump or a silicone cup or one of the various techniques that you can go and buy these kits online for relatively cheap, you're getting the same effect. It just might feel.
And your book can help people through that, yeah?
Yeah, my book actually breaks down the different types of cups, the main, most commonly found ones,
Sure.
how to put them on, where to put them on, and how to take them off, and pretty much everything you need to know to be up and running with cupping.
Sure. Okay. So could you share then some practical tips for beginners that are interested in trying this cupping therapy?
Yeah. So first of all, look at the different styles of cups out there. You have different materials, like I said, plastic ones, silicone ones are probably my two favorite ones for home use. I would avoid glass ones, just why have something that can break. Two, when you do apply the cups, start slow and shorter periods of time. So you don't have to go as strong as you can possibly take it. You don't have to leave them on forever. A few minutes just to see how it feels. And then you can always add them back if you need to get a stronger reaction, a bigger mark, or more relief.
Okay, so if we could move on to more East Asian medicine in modern practice. So how did you first become interested in East Asian medicine, and what drew you into it? Was there something else, other than your grandfather?
There was a few things. In college, I took a Chinese philosophy class, right? And when we talk about Taoism specifically, it's all about balance. Not too much this way, not too much that way, and harmony, and being in harmony with nature. And a lot of these principles translate into East Asian medicine, as some of the first practitioners were also Taoists or Buddhists, or they had some kind of philosophy that they were following. So yes, traditional medicines came out of this, but the system that developed became a fully fledged healthcare system. And that concept of balance is within every discipline of East Asian medicine. So whether you're doing acupuncture, whether you're doing one of the massage techniques, Tui Na, shiatsu from a Japanese perspective, moxibustion, which is an herb that we burn on the surface of the skin, even cupping therapy, which we adopted into the medical system about 300 AD formally, even though they've been using it quite earlier. And then herbal medicine. So every one of those things has to have a balance, right? And they're trying to counterbalance a condition in your body or help build something up that isn't strong enough, right? So the idea is how far back, when we get this common, this modern term functional medicine, a lot of those principles were borrowed from Chinese medicine to get them. How far back in that issue can we go to turn something back on, create that balance, and have the body work better again?
It's the yin and the yang, isn't it?
Exactly.
The balance.
Exactly.
Yeah. Okay. So in what ways then do you blend traditional East Asian medicine practices with modern healthcare approaches in your clinic?
So it's funny because in 2016, I've been in practice since 2001. In 2016, I took this bigger swing, and I looked at a bunch of therapies that were, higher tech, flashy, whatever you want to call them. But they had to do something that acupuncture did with, from a different method, right? So acupuncture, if we look at it from a Western standpoint, reduces inflammation, improves circulation, regulates immune system function. So I started to look at services that do those same things. And it's funny because a lot of these are well known, in the last few years, like whole body cryotherapy. Whole body cryotherapy was invented back in 1978. So, where it looks new and flashy and, we're going to get in this tube and we're going to get really cold, it has 40 something years of research on it. So for me, it worked because one, it's reducing inflammation, improving circulation from a Chinese medicine standpoint. And then two, it's got clinical research. We know that it's doing what it says it's doing, and it's also safe. These were the three criteria. Is it safe? Is it something that I don't need to do myself. I can train somebody else to do it. And then does it fit with the general principles of Chinese medicine? And because of that, we added red light therapy. This is another therapy that seems to be gaining a lot of popularity. I mean, you can't go on a wellness or a skincare webpage without them having some kind of red light mask. But once again, there's over 40 years of research on red light therapy and its family called photobiomodulation. So using different frequencies of light to affect the body. And as much as I love like the new age kind of let's feel this out, we also need to have the science behind it. And these services do.
Okay. So what role does evidence-based research play in shaping your approach to Asian medicine?
Well, it's funny because Asian medicine as a whole is like, a science practice like an art or an art practice like a science. You can put whatever word in front uh, that you want because they kind of point at the same thing. So we do want to have proof that these things work. And believe it or not, acupuncture has one of the largest databases of modern peer-reviewed studies. That's more so than physical therapy and chiropractic put together. And I'm specifically speaking about meta-analysis that you can find on the Cochrane database, which is one of the major places to go for clinical research. Within that, they have, I would say they started doing studies to kind of disprove acupuncture. And time again, they went, no, there's something here. And now it's more about trying to explain acupuncture and these theories of qi and channels during modern terms. And while they haven't been accurately able to explain how and why these things happen, they do demonstrate them happening and the physiological effects. So I really like having that data, not because it drives my treatment selections. I'm still using classical principles for those, but to be able to show a patient and say, no, I'm not making this up. Here's some studies. Here's some really good evidence. We see some crazy things. I see a lot of breech birth. And I mentioned moxibustion before. It's an herb we burn on the surface of the skin. Believe it or not, we burn a point on the pinky toe. And this is one of the most bizarre things. It still is crazy to me today after 23 years of clinical experience. We burn this on their toe, and there's about a 70% success rate that baby will turn before its due date. And it's, I said, no, that can't be true. But every month I get 2 or 3 women calling me out of the blue saying, look, I have a breech birth. They're going to do a C-section unless you can turn this baby. And within 3 or 4 treatments, we normally see something. And it's great to be able to offer that. And in my head, that's not just affecting, the mother. It's somehow affecting a baby that's just kind of floating around in there, which is super weird to me.
Can you explain that, why that happens?
I wish I could tell you. This is so the channel it's on is one of the major channels that we work on for conception. And it's the bladder channel. It tends to hit this lower part of the body. Okay. And its connection to the whole life cycle process is the theory that we're affecting, like, okay, cool, it's time to speed this up. You got to turn now. But as far as why it works, I don't know. And one of the things that's been lost in time is like, who's the first person to try this? Like, how did you go? Yeah, do that. Like, it seems so definitive. It's such a small area. It's on the corner of the pinky toenail. Like, you can't get more specific than that. And then it has about a 70% chance of working.
That's incredible. We'll take it. We'll just take it and we'll not complain.
Yeah, and the number of times, I don't think I'm that important. You come in and you see me, you do a couple of moxa sessions, and then I tend not to see the person. More often than not, that woman will call me while she's on the way to the hospital and say the baby turned. And I'm like, oh, well, thank you. Go
That's
have
great.
a kid. Go have a kid. Don't bother me. But it's such a crazy thing that you get to see, and it really, like I said, I'm still scratching my head after 23 years of licensure. It works. I'm happy to do it. But I wish I could explain it to you better.
Mm-hmm. Yeah. We'll just take it. That's fantastic. Who cares how it works? As long as it works, that's great. Yeah. What about skepticism then, or any misconceptions? Do you come across that in your practice, and how do you handle it?
It happened a lot more when I was younger. So one, I was relatively young in the field. My school was even a program for people changing careers. Mm-hmm. So I entered the program at 21, and the average age of a student was 35. So one, I had this barrier of me looking too young to know anything when I graduated. And two, back then, even some of the younger doctors were already hip. Some of the younger MDs were, but there were a lot of MDs. I had a patient tell me that his doctor told him I would give him hepatitis because he doesn't know if the needles are clean. And I said, does he know, like, we're regulated, like I have a license, there's, and they haven't used reusable needles since the early 80s. So this was already 2001. But that's.
Okay. Go ahead.
Sure. So, these doctors that are younger, especially now, we're getting referrals from them on the regular. Fortunately, last year I got to speak at 2 hospitals, to student, physicians, med students, I believe they're called. But within that, the view is very different now than it was then. I was called a grass skirt wearing hippie by a lawyer once, and now lawyers actively want us to treat their clients who have been in car accidents because they know that they're going to get better quicker, and then they can sue the companies for bigger money. But within that, the field has changed. When I first graduated, they would say about 1 in 10 Americans have had acupuncture. Mm-hmm. And after 20 something years, that number's got to be at least 3 or 4 out of 10. I can't imagine, maybe in certain areas where there's less acupuncturists, the population's different, but certainly on the coast, both coasts, it's pretty commonplace now.
I think people are turning more to alternative medicine and different techniques now. Yeah, I know I've had, and I had a bit of a frozen shoulder a few years ago, and it certainly made a big difference. Mm-hmm.
Yeah, and it's really hitting when we mentioned evidence-based medicine before. We talk about evidence-based medicine, and some people say, "Oh, it's just it's those double-blind, placebo-controlled studies." Mm-hmm. Yeah, those are important, but evidence-based medicine also includes the practitioner's knowledge and what the patients want. And I really feel that acupuncture has been growing so well, not necessarily because of the efforts of acupuncturists. We tend to be unorganized and there aren't too many of us, but because the patients have demanded it, and physicians see results in their patients, so they refer to us.
Mm-hmm. Okay. I think now's a good time. We'll stop for a quick break, but stay with us because Dr. Tom is going to tell us his fun fact. We'll be right back.
Holy Hydrogen introduces the most powerful health enhancement device in the world, the Lord's Hydrofix Premium Edition. Studies have shown therapeutic potential for cancer, diabetes, digestive and heart issues, and essentially every organ and system in the body. Visit holyhydrogen.com to see the latest technology that elevates your immune system and fights inflammation. This isn't medical advice, but if you have any health concerns, I strongly recommend that you learn more about hydrogen. Visit holyhydrogen.com to learn more about this groundbreaking gold standard hydrogen generator that for a reasonable price creates therapeutic quality hydrogen gas for inhalation and hydrogen infused water for consumption. Remember, holyhydrogen.com.
And welcome back. And I'm here with Dr. Tom Ingegno, and we're talking all things Eastern medicine. But first, Dr. Tom, tell us your fun fact.
So yeah, I have over 48 hours of tattoo on my body. It started as a graduate school gift. I got a symbol that comes from a 16th century Japanese acupuncture textbook. And over the years, it just kind of kept going.
Just kept going. So is it like sleeves you have?
So I'm at half sleeves now. My back and chest are pretty covered. Mm-hmm. I have a few on my legs. But when they say it's addictive, it certainly is. There is a bit of a rush when you get one. And I believe I'm not done yet. My father at one point, as they started to creep down past the sleeve, he said, those don't look too professional. And I said, Dad, most of them are covered by my shirt. If my shirt is off in the treatment room, the tattoos are not the thing we should be worried about.
It's very true.
It was a little crass, but effective. And with that, I've seen studies where they're like, I think 60% of people under 50 now have at least one tattoo. So it's become so commonplace in culture that I don't think it's going to inhibit my career.
No, absolutely not. Absolutely not. No, very brave man having that many.
Not really. It's just you kind of like the aesthetic, and I've never read a tough guy. No one ever considers me that. It's funny. I said something to a social worker we were networking with, and I said, "Look, I know I have tattoos and everything." She goes, "Actually, all I see is a bunch of flowers."
A bunch of flowers.
I mean, all the ones that stick out are mostly flowers.
Okay, all right. That was very interesting. All these tattoos. I want to play this video about Dr. Tom's practice. I'll give you a bit more information about him. So hold on one sec.
When you care about staying healthy or solving long-term health conditions to maximize your vitality, it can be life-changing. At Charm City Integrative Health, we serve patients looking to improve their overall health, including those seeking pain relief from acute and chronic conditions, and those needing relief from stress and anxiety. We even offer membership levels to maximize benefits. Call today for an appointment or visit us online to learn more about our clinic, staff, and services.
So a lot of different treatments there, Dr. Tom. So let's talk a little bit more about the lesser known. And I know we talked about acupuncture and cupping, and I know you mentioned a little bit there about red light therapy. So can you talk to us some more about some of the other ones that you find particularly effective?
Sure. Let's talk, because especially we're kind of getting into allergy season now. Salt therapy is one of my favorites. We have something called the salt cocoon, which is a single little pod, and you sit in that for a half an hour and you're breathing in salt air. This is another thing. This treatment goes back to ancient Greece. They put people into salt mines. There's a story about a Polish physician in the 1800s. He was stationed in a mining town, and not only did the miners not get the typical lung diseases that miners would, they generally were healthier. They got less colds and flus than the rest of the population in the town. And this was all because it was a salt mine. So his theory was that this microfine salt dust opened up the airways. Certainly salt can kill certain bacteria by drying them out. It breaks up mucus. And sitting in these salt caves really became a treatment for a lot of his emphysema, a lot of his asthma, allergy type patients, and they got really good results. So our little private cocoon here, you sit in that for about a half an hour. You can read in there, you can bring a computer in there, everything is safe. But most people tend to nod off. But in a half an hour, you're inhaling about 3 tablespoons of microfine salt dust. So you're not going to smell it, you're not going to taste it. But throughout the day, you're going to notice that your sinuses are drying out. You can take a deeper breath. So similar to a neti pot where you're flushing out the sinuses, but in this case, 1, it's dry. 2, you're inhaling it all the way down into your lungs. So you're really able to break up deeper congestion.
That's interesting. So is that why you always feel so good when you've been at the beach?
Yeah. Funny story. We had a French Bulldog. And I mean, he snored so bad, we actually got him soft palate surgery to give him a bigger airway. And he would shake the foot of the bed, and the whole bed would shake at night from snoring. Now we took him to my uncle had a beach house a block off the beach in New Jersey. And my uncle would let us use it. Great uncle. But we were there, and for a minute I thought the dog had died because he wasn't snoring. And it was just the salt air opened up his airways so much that he was breathing comfortably and relaxed. And I know that's an animal anecdote, but this is something a lot of people use in our clinic. They'll bring their kids in because it's absolutely safe for a child to sit in, whether that's an infant with a cold or, sometimes it's an 8-year-old that they give an iPad. Ooh, who's saying iPad? iPad to anymore, and just let them play for half an hour and come out feeling better.
Great. Okay. Can you talk to us a little bit more about the red light therapy? What's that all about?
Yeah. So this goes back to 7th grade biology when we learned that the mitochondria are the powerhouses of the cells. It turns out to stimulate the mitochondria to make more cellular energy. That's ATP, adenosine triphosphate. You need the building blocks, everything in that cycle that helps build it. The big one there is oxygen. But 2, red light stimulates those cells and the mitochondria specifically to start that process and makes that process work more effectively. So people will use red light therapy, and systemically you'll get an increase in circulation, but you're also increasing energy at a cellular level there, giving your body more ability to have cellular exchange of nutrients, repair tissue, and give your whole body kind of a little bit of a lift. Now, there are some cosmetic benefits to that. We don't consider ourselves a cosmetic clinic. We don't do fillers and facials and things like that. But what tends to happen, and we have a whole body red light machine, you're getting more circulation to the surface of the skin, so you're going to make more collagen. Your skin's going to look tighter. It can be used to help with discoloration, rosacea, those kind of things. And then we have some lights on those panels that look like they're out, and they're not out. They're just out of the visual spectrum. So they're near infrared. So they're just over that line of red where we can't see it anymore. But those wavelengths are moving at a different rate, and they tend to penetrate deeper, and they hit the muscles and deeper in the body. So they have an effect on the internal body. So they're stimulating mitochondria like muscle. In some cases, the intestines. Seeing some internal benefits as
well. Okay. Do you have any success stories for the red light therapy?
Yeah, it's one of these things that is so mild, and people are using it in conjunction. One of the things we do at our office that is kind of unique is we call it health stacking, where we're going to combine a bunch of services together in a way that makes sense based on what a patient's. So red light is often combined with our exercise with oxygen therapy. I mentioned that oxygen is necessary to kind of run that adenosine triphosphate cycle, sometimes called the Krebs cycle. So standalone red light, when people do it, they come out, they say, I feel relaxed, I feel slightly warm, machines do give off some heat. On our sauna is much warmer. But within that, nothing by itself. Normally, people are just happy to do it.
Mm-hmm.
They feel after. I wish I could have something that was like, oh my God, this was amazing. But normally, when people have those kind of effects, they're doing multiple services at all. So I can't really tease one out.
Mm-hmm. Yeah, they just feel good. That's the main thing, isn't it? Mm-hmm.
Yeah.
Yeah. So how do you determine which therapies people need when you're talking to individuals?
This is, we have people enter our clinic in a couple of different ways. Either they come for something that's a little bit more traditional. Hey, they want the acupuncture, they want the massage, and they start there, and then they kind of look around and they see what we have to offer, and they'll say, what else should I be doing with what I have? So then we get a chance to kind of help them figure that out. Now, depending on what they say, their signs and symptoms, we can combine things differently. So, never ask a barber if you need a haircut. I'm going to tell everybody they need acupuncture. But within that, some of the other services, cryotherapy, the sauna. Well, what's going on? Do you have musculoskeletal pain? Are you looking for more energy? Do you need to relax more? Those things are going to determine what we recommend and how often we recommend it. We have a cold plunge because the cryotherapy is great. But some people want to stay in the cold for longer. It's a little crazy, but I get it after doing it for a while. So they prefer the cold plunge, even though it's only, below, I think it's like 40 degrees Fahrenheit, where the cryotherapy gets the negative 256 if we go all the way up. So even though one is ridiculously cold, it's dry. When you're in the water and you're cold, you're pulling heat out of the core, it hits a little differently. So some people that were using the cryo so much that they're like, I'm not even shivering anymore, got in the cold plunge and they get a little humbled, but they do get an energy boost with that. They get a drastic reduction in inflammation. And then when you get out, your body wants to warm its blood vessels and pumps fresh blood to the tissue and, really gets this kind of like pump in and out. So get the inflammation out, get fresh blood in.
Yeah, very therapeutic, very therapeutic. Do you know of any emerging, therapies from, Eastern therapies that are coming up?
Eastern therapies are a little bit trickier because there's so much, and even going through school, things were talked about. But no, I don't think you guys can do that here. And, you start asking questions, is it dangerous? And a lot of times the answer was no, it's not dangerous. You guys just like to sue each other. So there's certain therapies that, and it's funny to even say modern therapies in traditional medicine, right? Because it's been around for thousands of years, and now we're going to do something to improve it. There's electroacupuncture that's been around forever, where they do hook it up to electric stim while the needles are in. We are seeing a lot more being done with lasers. So lasers to stimulate the acupuncture points in areas of the body. I'm most interested, and I know this sounds crazy, to how AI is going to affect our field, because we can call acupuncture, East Asian medicine, a softer medicine, right? It's not one size fits all. We do have to lean in on some of our intuition sometimes and say, well, this case kind of sounds more like this, so I'm going to go in this direction. A lot of that is subtle, and a lot of that hasn't even been translated into English yet. But to put that, 3,000 years, let's say conservatively, of information into an AI and be able to say, well, here's what's going on with the patient, and then have that AI spit out, if nothing else, more relevant questions. But to then help with diagnosis, that's where I'm really interested. I've seen
It's the interesting thing,
coming out saying, and I'm not a doom and gloom person when it comes to AI. I don't think we're going to live out the Terminator movie scenario.
Yeah.
But if we can have something that can process that volume of information that quickly and then apply it to a person, I think we're going to get some big wins. And it's not just going to be in Eastern medicine. It'll be in medicine as a whole. And certainly we're going to have to learn a lot to be able to do that effectively. But it's not something I'd shy away from. It's something I'm very
Yeah, why not embrace it if it's going to help? Yeah, absolutely. Okay, let's talk a little bit about Yang Shen, or nourishing life, and to stay vibrant at any age. So what exactly is it, and how does it contribute to overall vitality?
Yeah, so this is a concept that's been around forever, and it's always funny to me that, like, recently, let's say in the last 15 years, the term biohacking has come around, or what do we have, anti-aging medicine and all these things, and it's like, well, China's been doing that for like 10,000 years. And, we look at some of these services, and yes, they're high-tech stuff like cryotherapy, red light therapy, those kind of things. But when we do it from the concept of Yang Shen, it's about living your life in a way that you're having the ultimate, potential reached. And it's not these big excessive things. It's a lot about restoring your body on the daily. So it's more about the self-care. So of course, acupuncture, Chinese herbal medicine, cupping, moxibustion, these were all part of it. But that's more on the clinical side. That's more on what you would come to see me for. Now, what will you be doing at home is eating a balanced diet that was in line with the seasons. That means food and things that you can find in the area that you're actually living in. It is about meditating. It is about doing Qigong, so breathing exercises. And actually, Qigong means to move the Qi, to practice the Qi, the energy. And these aren't wishy-washy things. These are things that we do have studies about that are actually, yes, they reduce cortisol levels. Yes, they increase circulation. Yes, they help stimulate the mind. They help people from falling at older ages, right? They help with stability. All of these things go together to have a more full, rich life. So it's not this being, a rock star 24/7. It's about, how do I do things simply? Am I getting good sleep? What when am I sleeping? How long am I sleeping? And it amazes me today that, a couple of years ago, I learned that there is a doctorate in lifestyle medicine. Right.
Wow.
Right. And I go, wow, that's cool. What does that entail? Tell your patients to get good sleep. Tell your patients to eat quality foods. And it's like, have we moved this far away from it that we need the doctorate in that specifically? And for what it's worth, anybody that's in healthcare, and it doesn't matter if it's, you can call us whatever you want, alternative medicine, complementary medicine, or straight-laced Western medicine. That's part of our role, right? The term doctor comes from the Latin docere, which means to teach. So before you give the pills, before you do the thing, should there be something that patient can learn about this? And how do I articulate that in a way that they can hear it? Now, my mentor had a teacher in Japan who said, I don't give patients advice. It wastes my breath and hurts their ears. And then my mentor said, well, I just heard you talking to that guy about an herbal formula and about some exercise. And he said, no, he asked first, right? So the patient was ready to hear. So on one hand, yes, we should be telling patients everything they should be doing at home. But on the other hand, we need to hold back a little and wait until that person's ready to hear it or asks for it. They're ready when they tell you, hey, what else can I be doing? And that's when we kind of dive into the Yang Shen stuff. I love teaching meditation because of that. That is something that is practical for everybody. It doesn't matter if it's 20 minutes or 2 minutes or, just a few calm breaths throughout the day. That will have lasting benefits if it's built up over time.
Sure. And it's the awareness, isn't it? The awareness of the things that you could be doing better that you might not be aware of at the time, but can really, really help you in your progress. Yeah.
And a lot of, sorry.
No, carry on.
A lot of these things that we should be doing daily to help ourselves, right? When we have stress, when we're on the go, those are the first things that like disappear, right? I don't have time to meditate. What do you mean? I can't cook a meal today. I'll just stop and get fast food. And it's something we're all guilty of. So I'm not, this is not like a guilt trip for anybody. I do it too. But within it, those things that keep us healthy the longest should be the cornerstone of everything we do on the daily. And unfortunately, they're the first we let go of.
Yeah, it is. Just, to find just a couple of minutes just to, center yourself and take some deep breaths, calm yourself down when you're stressed. It's a really big thing. Okay. Meditation as a cornerstone of health. So how does meditation fit into your holistic approach to health and wellness?
So, well, going back to high school, I found a book called The Tao of Meditation, and I read it. And while I was working as a lifeguard, when I was off the stand, I would be practicing meditation for quite a bit. And it started a bug in me. Like I said, there was a whole bunch of things that kind of got me where I am today, and I think that was one of them. I'd take some meditation classes, some Tai Chi classes, these things to kind of stimulate the mental aspects of health. And when I got to graduate school, when I got into the acupuncture program, my mentor was teaching a meditation class through a Taoist lineage. And I started doing that. And then he introduced me to his teacher, and his teacher used to say, you might be meditate. He had this perfect broken English after being in the country forever and being damn near fluent. He would say, you might be meditate, that most important thing. And he'd say it like that, so he was teaching Qigong sets, these breathing exercise sets. And you would ask him, what's most important? Always it was meditation. Do the meditation. If you can't do anything else, do the meditation. There's an amazing book that was written by a bunch of researchers from all the Ivy League schools on meditation, and it's got research going back to the Timothy Leary time, the Ram Dass time in the 50s and 60s to modern times, and it's called Altered Traits. And what they mean by altered traits is like, right, we can have an altered state. We take a drug and our brain does something for a little while. Mm-hmm. With altered traits, we've actually rewired our brains. We've increased neuroplasticity. We've become more compassionate. We've become more rational. We've become calmer, and we've rewired our brain to it. And that book dives into all the research on what they call Olympic level meditators. So those are people that have done like multiple silent retreats, and they're monks up in the mountains that are just they're not doing anything but sitting there in meditation all day, and what happens to their brain. And then even for us, what changes happen if we're just meditating at least daily for a few minutes. And those benefits add up, and it's also one of these things that's very hard to say, this is exactly what I've gotten out of it, because I've noticed over time things, not this quick, your back hurts, the back doesn't hurt. That's a pretty quick switch. I can say, oh, it's better. Meditation is this thing where you're constantly polishing that gem, right? So it's slow, but our minds will work better. We'll be calmer. We'll be able to handle stress better. Mm-hmm. But it takes practice. And it's a cornerstone of my daily ritual. I mean, I haven't missed a day in over 5 years. And this is going back to high school where I didn't want to do it, or I didn't, I do it and then I go, I'm not doing it today. Or I'd fall into these spells where I do it for months and then I just miss one day and go, I'll get back on it tomorrow. Mm-hmm. And then that would turn into like 2 days and then a week and then a month. And then it's like, wow, I haven't meditated in a while.
But you feel the difference when you don't.
Oh, you definitely do. I don't want to say I'm off. I mean, my wife might say I'm off when I don't do it. But it is something that the more you do it, I don't want to say the better you get at it, because I still say I'm practicing meditation. Mm-hmm. Right? I haven't nailed it yet. But within that, every day does something for you if you sit and stop.
Yeah. You do feel better every day, don't you?
Yeah.
Mm-hmm. And scientific evidence is there as well. Look at, Dr. Joe Dispenza and all his research.
Yeah.
And mm-hmm.
Yeah. And as far as the method, because there's so many different ways of doing this, it's more important that you practice it than, pick a method you like, pick something you're going to stick with. Jose Silva, I found a couple of videos online from him, and God, he was big back in the 70s and early 80s, I think. His stuff is still great. Taoist meditation, of course, that was my first main one. I love that, the simplicity of it. But if you want to try transcendental meditation, if you want to try mindfulness meditation, all of them are great. You do get different benefits from each of them, but you can't go wrong with any of them.
Okay. And how long would you recommend people meditate for? Do you think there's I know you said it doesn't matter whether it's 2 minutes or 20 minutes, but
I would say start slow with this one. Do a short period of time and build the consistent practice. Because what's going to happen is, you might say, like, if I say 20 minutes, that first day you're going to sit there and do 20 minutes. That second day you're going to be mad that you got to sit there for 20 minutes. That third day you're probably going to do like 10 and go, I'm done. But if you start with just a couple of minutes and build, a 20-minute cycle doesn't feel too bad. That's just some time to recover and relax. But that takes time. And believe me, even today, I think I only did 12 or 15 because, well, I was getting ready for this. I was doing some other stuff, so I probably should have started earlier. I'll probably go do another meditation later. This is one thing what you shouldn't feel guilty about, but you should build a consistent practice. So a couple minutes to start, add a few every week if you're feeling like you can. The classic saying is, if you have time to meditate, do 20 minutes every day. If you don't have time to meditate, do an hour every day, which is, it sounds like a whole bunch of different idioms and expressions, but it's true. You want to make time for that. But that time doesn't have to be outside of your bandwidth. So start with what you can do.
Yeah, absolutely. And if you've only got time for 10 minutes, then you can do that. And quite often I find that with my intention of sitting down, okay, right, I've got about 15 minutes here, I'll do 15 minutes. And quite often it ends up being 30 minutes and it's just, it's flown by really, really quickly. So talking about meditation, I know you have an offer for the viewers. So do you want to tell them about it?
Yes. So another product of my, let's say, house arrest during COVID. They're going to say, oh, he talked about being in prison. No. But when we were all kind of on lockdown and I had to have my clinic closed, I filmed this meditation course. Back then I don't think I had the beard. But this is a free course on Udemy and it's very basic. It's meant to be very approachable. I think it's about 43 minutes long. I like to offer it as just a, hey, I want to spread the word on this. This is one way of doing it. This is not the absolute end all be all. It talks about the different positions, sitting, standing, kneeling to meditate. It talks about, clearing your mind and focusing on your breath. It's a great place for people to start if they've never done meditation before.
Okay. Sounds good. And for those that haven't, are not going to use the QR code, I'll put the full URL in this episode description. So, Dr. Tom, that was a great discussion. Thank you so much. You've given us a lot of information there. And it was really nice to have you. And I want to say thank you very much to the viewers as well for watching, whether it's live or on demand. And I just want to say until next time, you look after yourself and have a few minutes meditation. Thank you, Dr. Tom.
Thank you.
Take care.